Hello, I am Nurse Marcia, a retired nurse with over 30 years experience. My channel is for people who are looking for health information so they can better manage their health and also to help you better navigate through our healthcare system here in America. So today I'm going to talk about how to choose a health plan and how to best utilize your health plan. So let's get started. First, let's talk about some of the three most common types of health insurance plan. One is called a HMO, which stands for Health Maintenance Organization, sometimes called a health plan. Another type is called a PPO, which stands for Preferred Provider Organization. Another type is fairly new and it's called a high deductible health plan with a HSA, which is a health savings account. And I'm going to explain each one and I'm going to give you some pros and cons for each one. So the first one is the Health Maintenance Organization or health plan. You must utilize a health care provider that is in network or have a contract with that particular insurance companies. Some of these health care providers are employed by the insurance companies. Some of them are not, but it's best and it's cheaper if you stick with a health provider that is in the network. You get the list from the insurance company. Now, one thing you should remember, or I caution you on, sometimes you can have a primary care physician that is in network 1 month and he's not in the network the next month. So that is something that you have to continuously update. And how you do that, you need to keep checking with your insurance company to make sure your doctor has not fallen out of network, or you can always ask when you call for an appointment just to make sure that they are still in network with that particular insurance company, because if you utilize those services, you're going to have to pay for it. So I said I'm going to give you some pros and cons. So for the Health Maintenance Organization, one of the pro or positive is that it's usually cheaper. Your monthly premium and usually your yearly deductibles are going to be a little less if you are in an HMO or a health plan. Another positive with the HMO is that they promote health and wellness. They want to promote healthy lifestyles. They want to make sure that their clients get their yearly physicals, their wellness checks. They encourage people to get immunizations or yearly flu vaccines. So what are some of the negatives for the HMO? Well, one of the negatives is you have to utilize a doctor or a health provider that is in network. And just like I mentioned before, sometimes your doctor who used to be in the network right in the middle of the year for some reason fall out of network. And a lot of times they don't tell you. So you have to continuously, or I encourage you to continuously ask when you make an appointment to make sure that that provider is still in network. You can also take a look on that insurance company's website to see if that particular provider is still in network. Just because they're in network in January doesn't mean they're still in network in February or March or anytime during the year. Another negative is utilizing a doctor that is out of network. They frown upon that, and they usually are not going to pay if you take it upon yourself to go to a doctor that is out of network. That's why it's so important that you check on that insurance company's website to make sure the doctor or health provider that you want to go see is in network. I simply used to advise my patients to just call so you can get the most current update. Another negative is that you might need to have a referral to go see a specialist. If that's the case, you get the referral from your primary care doctor, and the insurance company needs to approve it. Another negative is that if the doctor orders certain diagnostic tests, especially when it comes to MRIs or CAT scans, more costly diagnostic tests, you will more than likely need to have pre-authorizations. Certain medications that your doctor may want to order you, you may have to have pre-authorizations. So the next type is the PPO, Preferred Provider Organization. Now, in this type of health insurance, you still need to see doctors that are in network, because these are doctors or other healthcare providers that the insurance company has gotten under contract, and they have more control of the fees that the doctors will charge. But you can also go out of network. It may cost you a little bit more money. Your insurance company will still pay a portion. Now, remember, if I didn't say so before, if you go out of network with a health maintenance organization or a HMO, if you go out of network, more than likely you're going to pay 100%. In the PPO, the doctors are never hired by the insurance companies. They simply have a contract with the insurance company. And again, the health providers can always discontinue their relationship with the insurance company. So as the patient, we have to always be abreast of if your doctor is still in network with that particular insurance company. And again, how do you do that? You can always call the insurance company, and you can, when you call and make an appointment with that healthcare provider, you can ask them. Get in the routine of always double checking to make sure, hey, are you still in network with the insurance company? And again, you can look on the insurance company's website, and you can also call the insurance company directly just to make sure that your doctor or the other health, any type of health provider that you're gonna go see is still in network. That will alleviate a lot of surprise billings. So I want to give you some pros and cons to the PPO. The number one positive with a PPO is that you don't have to have a referral to see a doctor. And you have a wider or larger pool of healthcare providers to choose from if you have a PPO. What are some of the negative or cons? In the PPO, it's going to cost you more money. Your monthly premiums are going to be more, and usually you're going to have more co-insurance or co-pays in this type of insurance. The next type of health insurance is called a high deductible plan with a health savings account. What does that mean? That means with this type of insurance, you're going to have a higher deductible. For example, with a PPO, a single person may have $1,000 deductible before the insurance kicks in. With a HMO, you may have a single person may have a yearly deductible of $500 before the HMO kicks in with paying for your overall healthcare needs. With this high deductible, well, it speaks for itself. You're going to have a higher deductible before the insurance company kicks in to help with the cost of your healthcare needs. So, in this plan, you also have a health savings account. What is that? These types of insurances are insurance that you are going to get through your employer, or you're going to buy directly from an insurance company. So with this high deductible health plan with a health savings account, if you are working, every time you get paid, you can have a certain amount of money deducted from your paycheck to go into this health savings account. Typically, your employer will also contribute to that account. So let's say, for example, your employer says, hey, every time you get paid, we're going to put $100 into that account until you reach a yearly amount of $3,000. So that's pretty cool, right? You as an employee, you also are going to contribute some of your money into that account, but it's going to be at pre-tax dollars. So for my own sake, I'm going to keep the numbers simple. Let's say that you earn $500 a week. Well, if you want $50 to go into your health savings account, that would be before Uncle Sam starts taking their cut. That $50 will go into that account. Now, remember, this is a high deductible health plan. So you may have a deductible for a single person of $3,500 a year. So when you go to a doctor and they charge you $100, you're going to have to pay the whole $100. But you can pay it from the monies that are in your health savings account. Remember, that is pre-tax dollars. And also, if you are working, your job has put money into that account as well. So what typically happens is you get a regular insurance card and you also get a debit card that is going to show the amount that is in your account, usually on a per paycheck basis. Let me just give you a scenario on how you utilize it. So let's say you go to the doctor and the doctor bills $100. You're going to be required to pay that $100. But you have this monies in your health savings account, right? So you simply pay the doctor from the monies you have in your health savings account. Now, you usually will get a debit card, so you can swipe your card right there on the day that you're seeing the doctor or that you're getting your health services. Now, once you reach your deductible, then your health plan, the health insurance needs to start paying your health care needs. So let's talk about some positives to this type of plan. Well, some of the positives are that is pre-tax dollars. And if you leave your job, you can still utilize the money in your health savings account for qualifying medical expenses. As long as you use that money for qualifying medical expenses, you will not be taxed on it. What are some other positives? Well, your job is also contributing monies to that account as well. This type of accounts are for people who are in general good health. So what are some of the negatives with this type of health insurance? Well, if you think that you're going to utilize a lot of healthcare services, meaning if you have some chronic issues, several different types of health issues, and you're going to be seeing the doctor a lot or having a high use of health services, this may not be the best plan for you. Another negative or con is that the IRS sets the amount that a person can put into their health spending account per year, depending upon if you're single or if you have a family. So that changes from one year to the next. So next, let's talk about how do you choose a health plan? Well, I'm going to share with you how Nurse Marcia chooses a health plan. Well, I generally start with the current doctors that I see. My current primary care physician, I want to make sure that they are in network when I choose a different health insurance. So I simply go to that health insurance website and I look for my current doctor, my primary care physician. I also look for just how many doctors do they have in their network, depending upon specialties and your healthcare needs. I also look for doctors in the network that are close to my home. I don't want to be traveling all over the city to see a doctor. So I want a doctor in network that is someplace close to me. I also look and see what hospital is in network in the event that I need to be hospitalized. I look for what different emergency rooms that are in network in the event that I have to go to the emergency room. Then I want to go to looking at the cost. What's going to be my monthly premium and what is my yearly deductible? If I want a low monthly premium, then usually you're going to have a higher deductible. If you want a higher premium each month you have to pay, then usually you're going to have a lower deductible. So that's how Nurse Marcia chooses her health plan. How do you best utilize your health insurance plan to get the best health care possible? Take advantage of the free stuff. That's right. A lot of these insurance companies nowadays are offering incentives or free stuff to patients, such as, did you get your yearly mammogram? Did you get your yearly physical? Did you get your yearly flu shots? A lot of the health insurance companies will offer rebates or gift cards if you do these things on a yearly basis. So why not get your health screenings, your physical, and get a gift card in return? Some of these insurance companies are offering discounted gym memberships. Find yourself a good primary care physician. When I was working at the insurance company, I found that so many people did not know what was covered in their policy and what was not covered. So I used to always say to my patients, get to know your health insurance policy. So you need to understand what's covered and what's not. If you have any additional questions about your policy, what's covered and what's not, always call and ask for them to send you something in writing. Send that policy in writing. So many times I've talked to patients in my career who did get the information in the mail and just didn't read it. You know, they threw it in the junk pile, and you would say, I'll get to it one day, and we never get to it. So I would always say to my patients, get to know and understand your health insurance policy. You can always call directly and ask them specific questions and to explain it to you in ways or in language that you can understand. They must explain it to you in language that you can understand. When Nurse Marcia worked at the insurance companies, one of my jobs was to authorize or deny a lot of diagnostic testing or some types of elective surgeries. And if I denied these things, I had to type up a letter in simple terminology that the patient can understand what the doctor was asking for and why we denied it. So I know that's a thing. Another thing I found so much in my career is that people get billed for services that are covered. So I started informing my patients, or I started teaching my patients, if you get a bill for a health service that you know is covered, first of all, tell them to rebill. Second, verify that they have your health insurance on file. Give it to them again so they can bill the correct insurance company. That is so common. So if you get a bill, first of all, verify your insurance, that they have your current insurance. I don't care if you've been going to a health provider for a long time. Sometimes that stuff gets lost. So make sure they have your current insurance. Make sure they have billed If they have billed, ask them to bill again under the correct diagnostic codes. So I hope this helps. Please subscribe to my channel, hit the like, leave a comment, and hit the notification bell. But most importantly, I want to be your nurse, so share Nurse Marsha. Don't keep me for yourself. Until next time, bye.